I'm Dr. Peter Leo, and I'm a dermatologist in Chicago, and I'm also the founding director of the Chicago Integrative Eczema Center. I am interested in bringing the best alternative and complementary treatments and using them in harmony with conventional evidence-based medicine to get people better. I treat a lot of different skin conditions, but one of the most common things that we see is psoriasis. And psoriasis has been around for a very long time. There are some discussions that it may have been described in some of the ancient Egyptian papyri that talk about the earliest types of medicine that we have. So this has been with people probably from the very beginning, and it is pretty common, on the order of 2 to 3% of the population. There are fortunately many conventional treatments now, and particularly in the past decade, we have seen this revolution with these biologic medicines. These are medicines that use antibodies that are very much like our own. Sometimes they truly are human antibodies that will block specific inflammatory messengers in the immune system to give relief and block the inflammation. It's pretty amazing. Many of the newest ones can do this without suppressing the entire immune system, which is incredibly helpful and much safer than the traditional and conventional things that were done just 10 or 15 years ago that really knocked out the entire immune system. But many patients don't want to use more powerful medicines if they don't have to. So we really try to do a step approach. We'll start with simple things, lifestyle changes, and gentler treatments, and then we can work our way up there for those who need it. But the goal is never to use those things where they're not needed, really to save them for the patients who don't respond to the simpler and gentler treatment approaches. Two alternative treatments that I really like and I like to think about in my practice are both actually based in some evidence. They have conventional studies that support their use. And the first is topical indigo. So indigo is, of course, a plant. It gives that beautiful deep blue color. And it turns out that if you can prepare a compound of indigo in a cream base or an ointment base, it actually has an effect on psoriasis. It turns out there was also a study that showed it had an effect on one of the most difficult parts of psoriasis to improve, which is nail psoriasis. Many people with psoriasis will have nail changes. Sometimes they're little pits, sometimes they're oil spots, sometimes there's onycholysis, the nail lifts off the nail bed. And it turns out indigo can help to a certain degree for some patients, which is really great with essentially no major side effects. We think you could potentially become allergic to it, like with many botanical agents, but generally speaking, it's pretty safe. And so I've seen some patients use that, particularly as an adjunctive therapy, with really good relief. The other little pearl that I like is something we all have in our homes, baking soda. Good old-fashioned baking soda, sodium bicarbonate. It turns out if you put maybe 1 to 2 cupfuls, it's quite a bit, so it might help to go to one of the big warehouse stores like a Costco and get one of the giant bags. It'll be much more cost-effective, but you can take a big scoop, a cup or two, put it in the bathtub and soak in that. There was a study that actually showed it decreased the severity of psoriasis. It's sort of an old-fashioned treatment, but it seems to help. And maybe it's doing something like recapitulating one of the mineral type springs. In a way, mineral water is fortified with different types of elements. So sodium is not an uncommon part. And of course, with seawater, we of course have sodium chloride in the ocean water, and these things have been known to be helpful. So using a little bit of the bicarbonate really seems to help, and indigo is something else we can use. Beyond this, we'll often find lifestyle changes that can help. There's no doubt that when patients change their diet to eat a little bit healthier, a little bit more clean, if you will, a term that doesn't really have the best definition, but I think many patients know what we mean by that. Generally speaking, less processed food, lower glycemic index, less carbohydrates in general. The diet that I'll actually tell people to look towards is the paleo diet. I think that is a good way to think about it. Otherwise, it becomes this exclusion. People say, gosh, I can't have this, I can't have this, I can't have this. I say, let's not think that way. Let's talk about it in terms of what can you have. Let's talk about our positive approach to eating. And the paleo diet makes a lot of sense to me because it essentially cuts out carbohydrates, processed food, lots of junk food. And the way I tell my patients to use it is to think about salad as the centerpiece for every meal. So it can be a salad with some eggs for breakfast. It can be a salad with some meat or fish for lunch or dinner, and then sometimes just a salad with other roasted vegetables or tofu, other plant-based sources can be very, very helpful that I think will help get people in good shape, getting their bodies running efficiently, and also make them most likely to respond to other treatments, because many times we'll find even dramatic changes will not cure the disease. It's not the cause of it, but it can have a big effect on it. So putting everything into alignment can really help, and that's our goal. I'm much more interested in getting people better than I am about being dogmatic about anything. So I try to keep an open mind, and I'm interested in finding new ways to help, no matter what tradition it comes from. Thank you very much, and hope to see you again soon.